Carla's death by Daniela Mora, Carla Caputo, Matthew Rothman, and Nicole Reguera. Carla Caputo on May 16, 2016, on a rainy morning, was feeling very fatigued. After checking her temperature in the morning, she had 101 fever. Her husband, Matthew Rothman, had suggested that she should go see a doctor. Matthew and Carla have been having a rocky relationship. 2 weeks before she had been feeling sick, Carla filed her insurance claim of $1 million. Matthew and Carla had been fighting constantly and Carla wanted a divorce. Later that morning, Carla drove herself to Mercy Hospital in Miami, Florida. When she was admitted, the doctor took her vital signs and concluded that the body temperature was at 102.1, her heart rate was 100 beats per minute, her breathing rate was 10 breaths per minute, and her blood pressure was 140/95. She had high blood pressure, fever, and a low breathing rate. The doctor ordered X-rays of her heart and lungs. Because of her symptoms, the doctor immediately started giving her fluids to keep her hydrated. When the X-ray results came back, the doctor found her air sacs in her lungs filled with fluid. This is very common with pneumonia. The doctor started to treat Carla with penicillin, antibiotics for 3 days, and oxygen therapy every day. Carla's family and friends have been very worried and have visited her constantly in the hospital. On May 19, 2016, at 3:20 p.m., Carla was found dead on the hospital bed. The police was immediately contacted and Carla's case was now being investigated.
Hi Carla, my name is Dr. Martinez. How are you feeling today? Not very well. Okay, well I'm just going to check your vitals and I'm going to see how you're doing. So, I'm going to test your reflexes now, okay? So, you feel that? Yeah? Okay. So that's fine. And now we're just going to check your temperature. So can you please open your mouth? Okay, well, you have a fever. It's at 102. So we're going to have to give you some medication for that. And I'm just going to check your breathing rate and your heart rate. So I'm going to ask you to breathe for me deeply and cough. So breathe first. Breathe. Okay. And now your heart rate. Okay, well you have 10 breaths per minute and 100 beats per minute. So now I'm just going to check your blood pressure. Sorry. I didn't give you the book. Everyone's getting tired. Yeah. Okay, well, it's at 140. So, a nurse is going to come back here and give you some medication and give you medication for those vitals. And I'll see you later. Thank you. Thank you. Okay, so after I left, I went and ordered an x-ray of your lungs, and we found that your lung air sacs are filled with fluid, so that means that you have pneumonia. So you're going to have to stay here for another 2 days. Maybe on the third day you can go home, but for now we need to keep an eye on you, okay?
Carla's medical history. Carla has never been admitted to the hospital for any illness or injury. Her family has had a history of diabetes. Her father and grandmother both had type 2 diabetes, but Carla does not have diabetes. On May 16, 2016, Carla was admitted in the hospital for pneumonia. Carla's illness, pneumonia. When she was admitted, her body temperature was at 102.1, her heart rate was 100 beats per minute, her breathing rate was 10 breaths per minute, and her blood pressure was 140/95. She had high blood pressure, fever, and a low breathing rate. When you have pneumonia in your lungs, your air sacs are filled with fluid. At the right, you can see Carla's x-ray that, as it is circled, her lungs were filled with fluid. Evidence. The evidence found on the scene were muddy footprints, a syringe, fingerprints, a police report, and the visitors list requested from the hospital. The visitors list contained Nicole Reguera, which went from 8:50 to 9:30, Bob Duncan from 12 to 12:30, Matthew Rothman from 3 o'clock to 3:20, and Lily Harris from 3:20 to 3:25. At the bottom, we took the fingerprints of the suspects: Lily Harris, her friend; Matthew Rothman, her husband; Danny Mora, the nurse; Carlo Caputo, the patient; Nicole Reguera, the sister; Bob Duncan, the brother. At the scene, there was a trail of muddy footprints. From the suspects, we took pictures of the shoes of Matthew Rothman, Nicole Reguera, Lily Harris, and Bob Duncan. After analyzing the footprints and the patterns, Matthew Rothman's shoe is the perfect match to the footprint at the crime scene. Here is the police report of the domestic abuse between Matthew Rothman and Carlo Caputo. Also, here is the syringe found with residue in the trash located in Carla's room. This is the autopsy report. The autopsy report concluded that the contents in the blood had Valium, which is a sedative, and potassium chloride. And also on her body there was bruising on the left hip and incision on the right arm where the IV was injected. So the possible causes of death was the lethal injection, potassium chloride, causing the heart to stop immediately.
Wait, sorry. Hey sis, are you okay?
I'm not feeling very well.
Oh my god, I hope you feel better. I called mom and dad and they said that you were feeling pretty bad, so I came and visited.
Thank you.
Hey sister, how you doing?
It's my last day of antibiotics. Bob.
That's good.
Yeah, I don't feel well.
Hi Carla, how have you been feeling?
A little better.
Alright, well I'm going to put a sedative here in your IV bag just so you can calm down a little bit. And today's your last day of antibiotics, so we're going to see, the doctor's going to come in and see how you've been progressing.
Okay, is it gonna make me fall asleep?
Yeah.
Okay.
Alright, I'll see you soon. Bye.
Carla! Carla! Code Blue! Nurse!
Conclusion of death. In conclusion, after revising the evidence presented in the crime scene, the person who murdered Carla Caputo was Matthew Rothman. Matthew Rothman, the husband, was the last visitor who came in before Lily Harris, who found her dead in the hospital bed. Both Rothman and the nurse's fingerprints were found in the IV bag, but Rothman's fingerprints were also found in the syringe, which contained potassium chloride that stopped the heart immediately. The fingerprints that Rothman left in the crime scene were also part of the evidence. The footprints were directed toward the hospital bed, and after looking at several footprints of the visitors that were there, the one that matched the muddy footprint close to the IV bag was Matthew's shoe. Matthew Rothman's injected a lethal injection into the IV bag, which went directly into her veins and stopped the heart. A lethal injection is a 3-drug cocktail that includes a sodium thiopental for sedation, panchronium bromide for paralysis, and potassium chloride for stopping the heartbeat. Matthew Rothman's motive for killing Carla was that he resented her because she filed for a divorce, and also because the insurance money he was going to gain after she died was $1 million.